Hello, my name is Elisai Fernandez, and I am a student here at Trinity Christian College. So, a little bit about myself. I am currently double majoring in criminal justice and psychology. Um, the main reason why I am majoring in psychology is because in high school, I was always interested in learning about the human behavior and learning about the human mind, and I've always wondered why a person thinks the way they think and behave the way they behave. Um, like what makes a human a human. But also, I think it's important to study psychology because not only does it shed a light on human behavior and like help us understand um, the way we act, the way we do, but it also offers other insights in our human experiences and helps us connect with others and can really mean the difference between a life well lived and a life that's filled with challenges. Um, so moving on forward, I chose PTSD as the disorder to research for my final project because I've always wondered as well, like what a person with PTSD has to go through with their everyday lives. How does that impact them as a person, and how does that impact those who are surrounding that person? Uh, how does that like affect the way they work, the way they behave, the way they react to certain things? And I just thought that was gonna be, I just thought it was gonna be a pretty interesting disorder to look at. Um, but yeah, so let's get started. So, post-traumatic stress disorder, also known as PTSD, is a real disorder that develops when a person has experienced or witnessed a uh, horrific, shocking, terrifying, or even a dangerous event. And these stressful or traumatic events often usually involve a situation when someone's life has been threatened or even they have been severely injured. And children and adults can both experience this, um, but also uh, they may feel anxious or stressed even when they are not present in danger or not facing anything that could be life threatening. And most people who go through traumatic events may have temporary like difficulty adjusting to it and coping with it, but with time and good self-care, they usually get better. However, if the symptoms get worse from the last 4 or even years, and it interferes with someone's day-to-day functioning, that person may have PTSD. Now, to answer the question, what causes it or who gets it, um, anyone can develop PTSD at any age, and this includes a lot of different types of people. For example, it could include veterans from wars, people who have experienced or witnessed a physical or sexual assault, abuse. It can include people who have been in accidents in a natural disaster, or even other serious events uh, that made them feel stress or cause a traumatic experience. But not everyone with PTSD has been through a dangerous event or a traumatic event, because sometimes learning that a friend or a family member has experienced trauma can even cause PTSD. And more to that, PTSD could be also a genetic factor. For example, having a parent with a mental health problem is no is thought to increase your chances of developing the disorder. So moving on to the symptoms of post-traumatic stress disorder. Uh, the symptoms may start within a month of a traumatic event, but sometimes symptoms may not appear until years after the event. And these symptoms can cause like negative consequences during your social or work situations, and with friendships like family, friends, and other loved ones. But they could also interfere with your ability to do like your normal daily routines and your tasks. When it comes to PTSD symptoms, it's generally grouped into four types, which is intrusive memories, avoidance, negative changes in thinking and mood, and changes in physical and emotional reactions. So, with intrusive memories, some symptoms may include recurrent, unwanted, distressing memories of the traumatic event, reliving the traumatic event as if it were happening again, so like flashbacks, upsetting dreams or nightmares about the traumatic event, severe emotional distress or physical reactions to something that reminds you of the traumatic event. Moving on to the avoidance, some symptoms may include trying to avoid thinking or talking about the traumatic event, avoiding places, activities, or people that remind you of the event. And for negative changes in thinking and mood, symptoms may include negative thoughts about yourself, other people, my bad, negative thoughts about yourself or other people or even the world, hopelessness about the future, memory problems, including not remembering important aspects of the traumatic event, difficulty maintaining close relationships, feeling detached from family and friends, lack of interest in activities you once enjoyed, difficulty experiencing positive emotions, and feeling numb emotionally. Now, with the last category, changes in physical and emotional reactions, some symptoms may include being easily startled or frightened, always being on guard for danger, self-destructive behavior, such as drinking too much or driving too fast, trouble sleeping, trouble concentrating, easily frustrated and irritated with angry outbursts or aggressive behavior, overwhelming guilt and shame. These PTSD symptoms can vary intensity over time. You may have more symptoms when you're stressed in general, or when you come across reminders of what you went through. For example, you may hear a car backfire, and relive combat experiences, or you may even see a report on the news about a sexual assault and feel overcome by the memories of your own assault. Um, but some important key aspects to know when to see a doctor could be if you are having disturbing thoughts and feelings about a traumatic event for more than a month, if they're severe, or if you feel you're having trouble getting your life back under control. Um, that's when a person should talk to a doctor or a mental health professional. Getting treatment as soon as possible can help prevent PTSD symptoms from getting worse. I think it's also important to note that not everyone who experiences trauma develops PTSD, and also that not everyone who develops PTSD requires psychiatric treatment. For some people, symptoms of PTSD could disappear over time, and others could get better with the help of family, friends, or clergy. But many people often need professional treatment to recover from their psychological distress that can be intense and very disabling. So some of the treatments used to treat people with PTSD is cognitive processing therapy, which is an evidence-based type of therapy, and it's specifically to treat PTSD and comorbid symptoms, and it focuses on changing painful negative emotions such as shame and guilt and etc. and beliefs due to the trauma, and therapists help the person confront such distressing memories and emotions. Another one being prolonged exposure therapy, and what they do is use repeated detailed imagining of the trauma or progressive exposures to symptom triggers in a safe, controlled way to help a person face and gain control of fear and distress and learn how to cope. For example, virtual reality programs have been used to help war veterans with PTSD, and so they can re-experience the battlefield in a controlled therapeutic way. However, some medication can help control the symptoms. In addition, the symptom relief that medication provides allows many people to participate more effectively in psychotherapy. Some antidepressants such as SSRIs and SNRIs, which are selective serotonin reuptake inhibitors and serotonin norepinephrine reuptake inhibitors, are commonly used to treat the core symptoms of PTSD, and often they are used alone or in combination with psychotherapy or other treatments. So the next section of this podcast, I will be interviewing a an adjunct professor, and her name is Tabitha Jersa. And so yeah, let's get to that. Starting recording. Okay, it's recording.
Perfect.
All right, sounds good. So let's get started. So hi there. My name is Elisai Fernandez, and I am a student here at Trinity Christian College. And today I'm here with
Tabitha Jersa.
Nice. And so tell us, Tabitha, tell us more about yourself. Like, what is your professional title?
So currently, I'm a licensed professional counselor.
Mm-hmm.
I have the hours. I'm just waiting to take the exam for the licensed clinical professional counseling exam.
All right. And where'd you get your education from?
So I got my undergraduate and my master's degree from Trinity Christian College.
Nice.
And currently working on my PhD at Governors State University.
And how long have you been teaching here at Trinity?
I've been teaching as an adjunct since fall of 2021. Mm-hmm. And then as part of my PhD internship, I've been teaching in the master's program just this semester.
All right, sounds good. All right, so let's get started with our interview questions. So, what is your experience with the post-traumatic stress disorder?
So I've worked in a residential center, and then my graduate internship and then post-grad work has been in private practice. And so I found both the clients that were in the residential center, we focused on mood disorders and eating disorders, but it was evident that there was also that co-occurring post-traumatic stress disorder or complex PTSD also present with a lot of those residents. And then I have found that in many of my private practice clients as well.
Okay. All right. Sounds good. So what is the etiology or the origin of PTSD?
Ooh. We're going to make my brain work today. So I guess it depends, at least from my perspective. In general, I think it starts from a developmental standpoint. I think that so if there's chronic, so this again gets into the complex PTSD. So if there's this chronic lack of attunement or abuse or trauma that they're getting exposed to, I think that impacts their nervous system and how they're developing and able to handle both just setbacks or other traumatic experiences. Or then for one time incident or the isolated event PTSD experiences. I think that comes from an individual experiences an extremely stressful event, again, considered a traumatic incident that then impacts their nervous system and how they're able to cope with that.
So would you say PTSD is more diagnosed from environmental factors?
I would, yes.
Oh, okay. Nice. All right. So what are the main symptoms? Some of my experience with PTSD.
So I would say, it's going to go out of order, I know, of criteria and stuff, but so the first thing is they have to have been exposed to that traumatic environment or experience or incident, but they might experience flashbacks, and something that I have found to be a little bit newer of a concept is the idea of emotional flashbacks. So while they might be oriented to the where they're at and the time, and it doesn't feel like they're necessarily cognitively back in that original environment. Emotionally, their amygdala kind of gets hijacked, and so emotionally it feels like they're back in that setting, even though they might not be like this small child again, or with, someone that's causing harm. So flashbacks, intense increased heart rate, dissociation. Ooh, I'm having a hard time, like, without, like, probably just because I'm on the spot trying to recall, like, what I look at. Avoiding the situation or, like, the triggers. I think increased reactivity to the triggering event or things that, like, represent that environment.
All right. So how would you say that impacts individuals' development?
Well, again, I think depending on when the situation occurs or how frequent it occurs, or again, even the nature of it. Did it happen within the context of a relationship or, something that they're going to continuously interact with in another way? I think it can impact their development because I think that there's an increased likelihood that they're going to, again, if they're engaging in avoidant behavior or giving into sort of that fear, then that impacts how they're viewing their world, how they're viewing themselves, other people, and like what is considered safe and unsafe. And so they might start to create systems within their world to work around the trigger, which, I mean, I've found where like that's taken people out of experiences that they would like to engage with. Maybe they avoid pursuing relationships or not going for certain goals, or avoiding movie theaters, or asking for help on certain things because they're trying to avoid getting triggered in that same way.
All right. Let's see. So, what kind of evidence-based treatments must we offer clients or people with that disorder?
Like what specific modalities? Is that what you're asking?
Yeah.
Okay. So I think that this can depend on who you ask. I think that there's a variety of different perspectives that people take. And I think that there's the quantifiable evidence-based, and then I think that there's the qualitative research that sort of advocates for different models. And so I think what it does is it comes down to what is safe and works for an individual. Recently, I have found, like, I personally like using like IFS, which is more of an integrative approach, where I have found that it honors sort of that like hijacking of the nervous system, while also creating a safe space. So we're not completely flooding the individual, and we're honoring like the protective measures that the client utilizes to try and keep themselves safe from like this situation. I've also just got trained in EMDR, and that I have found fascinating because it kind of ties in the core beliefs of a person with also the physiological aspects, like the way that the brain and the body connect to each other, and how the body will continue to carry this burden. Again, like just by simply like receiving data from the environment that they may cognitively or not like connect to a triggering event, which kind of puts them vulnerable to having those flashbacks. But like, so utilizing like the brain's pathways to sort of like help release it from the body using bilateral stimulation. So that I think is pretty fascinating. But I'm personally in the earlier stages, but during the training I have found a lot of the testimonies and stuff from both like the trainers, but also like fellow clinicians who've been in the field much longer than I have, to have some pretty amazing, uh, done pretty amazing work with that.
Mm. Uh, well, if you have any experience with someone that was suffering with PTSD, do you mind telling us, sharing that experience with us? Like, how was that like?
Um, yeah, so I think about like one client I worked with. She had, it was a specific incident with a car accident. And so it made her afraid to drive in cars.
Mm.
And so with her, we did utilize some exposure therapy with
Okay.
it. But again, keeping in mind that it wasn't just like flooding. We went in pretty slow, and the whole time, like, it wasn't just, okay, like, first, how is it riding in the car? It was like thinking about what it would be like in the car.
Mm-hmm.
And at the same time, pairing that with, again, like, we call it like parts work, but looking at what is sort of like that story she's telling herself, or how is trying to be controlling in the situation or avoiding riding in cars with other people, like,
Mm-hmm.
how is that serving her? And also, what is that taking away from her? Because there was like a lot of like things that she was missing out on. Um, and so this particular client, I think, was very motivated. Um, but even then, it was something where I noticed that at times, like, we did go kind of slow.
Okay.
I'm a believer in, like, when we're trying to do this work, like going with the slowest part of the nervous system. Um, so we didn't want to completely like flood her and then again create a space where she again felt unsafe.
Mm.
And then I think just as a clinician, I thought it was really neat to when you start to see like, oh, okay, like this is working. She went on a road trip then
Yeah.
with
Mm-hmm.
her partner, but
Yeah.
being like, it just like, so on that side, like being excited about it, but then also just like, I don't know, being mindful about like wanting to support her
Mm.
through it.
That's good. Thank you for sharing your experience with us.
Mhm.
So now we move on to the final question. So what would you say to people that are suffering disorder and their loved ones?
Ooh, I think the biggest thing is both for the individual and their loved ones is just to like give compassion.
Mm.
Like it's a really tough experience. Again, it's a hijacking of their nervous system. You know, that threat response, it gets activated, and most of the time the person does not want to experience that, and
Mm.
they also find, you know, some frustration in needing to avoid experiences, which that can add a burden to their loved ones, because it can be challenging to be with someone or to be the parent of someone that has a difficult time engaging in activities, or that, you know, get triggered maybe by something specified, or maybe they're unaware of what's triggering these episodes.
Yeah.
But to just give grace that it's not a moral failure or defect. And also just, I think, that hope that it can get better. Again,
Yeah.
I've worked with people where like various types of abuse. Um, and again, like then also like some things that maybe are a little less dark. And again, something like just like a car crash that could have happened to anybody. Um, but I've seen growth, and the growth can look different for different people. It might go at different rates. So I think having an understanding like of what's going on in the body, feeling safe in the process, and just like, again, that hope that life doesn't have to stay that way.
Mm. Well, thank you so much, Professor Tabitha, and we're very thankful for what you're doing, helping people out with PTSD. I know it's like a very complex and a difficult thing, but we are very thankful that you are there, are very caring for these people. And yeah, that's it for this interview. And thank you so much for your time.
Of course. Thank you.
All right, recording. Sorry for that poor quality. It's just that um, I re- I had to make my interview in a meeting, in Teams meeting, and I had to extract the audio from the video, so I had to download it and stuff. But moving on forward, so I think this was a wonderful experience for me, especially setting up the interview. This is my second time interviewing someone and creating a podcast as well. And it's like it's still very new to me, but I think it's a good experience and a good learning experience. Um, but so my final thoughts about the disorder is now I have a very good understanding of what a person actually has to go through with their everyday lives. Um, for example, like before this, I didn't know much about PTSD. All I knew really was that it happens when someone experiences something traumatic. That's pretty much it. But I did not necessarily uh, know the exact symptoms and what a person has to face. Um, and I think it was wonderful working with uh, Tabitha. She was honestly a very kind and sweet person that has helped me a lot with this. More specifically, she provided like good information on how PTSD develops in people and how most of the factors are environmental because they have experienced some type of abuse or lack of attunements or traumatic events. But it also means that, like I was saying earlier, that PTSD can be developed genetically as well. Um, However, that's not really common. Tabitha Jersa also mentioned some new symptoms that that I did not know about yet. For example, having emotional flashbacks. So basically, emotional flashbacks make the person feel like they're actually back to the setting or the event that they had experienced, the traumatic event. And these flashbacks cause them to have their heart rate increase as well as some dissociation. And to those who are asking what is dissociation, it's basically the disconnection or the separation of something from something else of the state of being disconnected, which I thought was pretty interesting learning about that. But it also reminds me of something. It reminds me that a person can possibly feel numb while they are experiencing PTSD because they are disconnected from their own emotions and their own thoughts. But it also reminded me of uh, derealization, which is a mental state when a person feels detached from their own surroundings. The people and the objects around them feel unreal towards them. And the crazy thing is that they are full aware that it isn't a normal state of mind. But overall, I really enjoyed uh, working with this project because it has led me to do research on my own and find people out there that have experience with clients that who are diagnosed with PTSD. So it really pushed me to go out my way and find out these answers for my own. And after researching the disorder on my own and setting up an interview, I learned that there's many ways a person can get diagnosed with PTSD, and there's many symptoms that go along with it. And another something else that's pretty interesting to me is that not everyone that experiences trauma gets diagnosed with PTSD, and that really made me think a lot because it has led me to ask more questions that I could possibly research next. Like for example, like how come there are some that go through the hardest and the most difficult experiences and still come out to be okay? Like, is it because some are more sensitive than others? Is it because of the way we are raised? Um, but yeah, these are questions that I would love to answer next time I research more about this because I think they're pretty interesting to ask. But overall, I also think that PTSD is an important disorder to keep a lookout for those who are diagnosed with it. Um, I think it's important to understand that being patient with the person diagnosed is the key to helping them overcome the disorder because it could have been a very difficult situation or an experience that they had to go through, and it's not an easy thing. Um, and Everyone has gone through storms and battles, but no one's battles are greater than the other. For me personally, I've never been diagnosed with PTSD, um, but I did experience some things in my life that a person could consider traumatic. Though I am not diagnosed with it, sometimes thinking about it makes it like sometimes thinking about the situation or the experience I've gone through, it triggers an emotion for me in the inside. Like I've moved on from it, and I've moved on from the past, and I've learned how to cope with things I've experienced. But doing this kind of hits home for me, and I'm super glad, like very glad that I was able to research this because it honestly could relate to me in a way, uh, and I just wanted to have a good understanding of what others have to go through. And yeah, this is my podcast, and I would just like to thank Professor Mario Guzman for giving us the opportunity to create something like this, and I think it was a very wonderful experience. Thank you so much.